You know, whenever you interact with a doctor, a nurse, anyone in healthcare, there's this invisible force at play. It's so much more than just their medical training. It's this deep internal compass that guides every single thing they do. Today, we're going to take a look at what that compass is really made of. Seriously, have you ever stopped to think about it? Past the tests, the charts, the medical jargon, what's really driving the person who's taking care of you? What are the core beliefs and the hard and fast rules that are guiding their every decision? Well, that is exactly what we're about to dive into.
All right, to get to the bottom of a professional's actions, we have to start where it all begins, inside the mind. And a really powerful way to look at this is through the lens of psychology, especially the ideas of Sigmund Freud. He argued that so much of what we do is actually driven by things we're not even aware of, these hidden motives and internal clashes.
So Freud basically said our personality has three parts that are always in a bit of a tug-of-war. First up, you've got the id. Think of it as your primal instincts, the part of you that just wants what it wants. Then there's the ego, the practical manager that's trying to get the id's needs met in a way that works in the real world. And finally, the superego. That's your conscious, your inner moral voice telling you what's right and wrong.
This right here, this is the perfect picture of that constant internal negotiation. So imagine you're in a super important meeting, but you are absolutely starving. Your id is basically screaming, "Food, now!" But then your ego, the manager, steps in and goes, "Whoa, hold on. We can't just start munching on snacks right now. Let's just wait for the lunch break." That little conversation in your head, that's the ego doing its job.
Now check this out. This is where it gets really fascinating. The part of our mind that we're actually aware of, the conscious part, is just the tip of the iceberg. We're talking like 10%. A whopping 90% is operating completely beneath the surface. That means most of the internal drama that shapes who we are and what we do is happening in a place we can't even see.
So, how does that hidden internal world actually make its way into a hospital or a clinic? Well, it shows up as something we can all see and feel, a professional's attitude. This is how that inner world of instinct, reason, and morality shows up in their everyday work.
You know, a great professional attitude isn't just one single thing. It's a whole mix of critical mindsets. It's having the curiosity to keep asking questions, the self-confidence to make a tough call, and of course, the kindness and tolerance to deliver care with real humanity.
And those internal attitudes, they are the absolute foundation for these crucial professional behaviors. Things like being a good communicator, a great team player, or taking responsibility for your actions, these aren't just skills you learn. They're the direct result of that balanced internal compass we've been talking about.
And here's the bottom line. This isn't just about making the patient feel good, although that's huge. A healthcare professional with a genuinely positive attitude helps build a healthier, better functioning system for everyone involved. It leads to better care, and for the providers themselves, it leads to much higher job satisfaction. It's a win-win.
But look, a good attitude on its own isn't enough, not by a long shot. Healthcare is built on a rock-solid foundation of ethics, a set of rules that are frankly non-negotiable. They guide every single decision.
At the very heart of all medical ethics, it really boils down to four core principles. Think of these as the North Star, the ultimate guideposts that make sure patient care is always on the right path.
Okay, let's break these down in simple terms. Autonomy? That means you, the patient, are in the driver's seat. It's your right to make informed choices about your own health. Beneficence is the duty to always do good for the patient. Non-Maleficence is that famous oath to first do no harm. And justice? That's the promise that every single patient will be treated fairly without bias.
So if those four principles are the main pillars, they're standing on a foundation made of a whole set of ethical values. These are the day-to-day qualities and standards that bring those big principles to life.
These values are like the tools in their ethical toolkit. Competence means they have the skills and knowledge to do the job right. Veracity is simply the duty to be honest. And compassion. Compassion ensures that the care isn't just technically correct, but that it's also deeply human and empathetic.
And then there's one of the absolute biggest, confidentiality. This is the bedrock of trust between you and your provider. It's the promise that your most personal information is safe. Honestly, without that trust, the entire relationship just crumbles.
But that brings up a really critical question.
Is that promise of confidentiality totally bulletproof? Or are there some situations where a provider might actually be required to share your information?
And the answer is yes. There are a few very specific, legally defined exceptions. For example, if you give them your consent, or if it's a life or death emergency, if a court orders the release of information, or during things like official healthcare audits. In these rare cases, the duty of confidentiality can be overridden to protect you or the public.
Okay, so we've gone deep into the mind, we've talked about attitude, we've laid out the ethical rulebook. So what? What's the big takeaway here? Why does any of this actually matter to you?
It's because knowing this stuff is a total game changer. It empowers you. It transforms you from being a passive patient into an active, informed partner in your own care. When you get what's guiding them, you can ask better questions, and you can be a better advocate for yourself.
At the end of the day, this inner compass, this blend of psychology, professional values, and ethical rules is what ensures you're treated like a person, not just a problem to be solved. It's the invisible framework that turns the science of medical practice into the art of human care.